a few people coming in. Hi, Elizabeth. It's good to see you.
Hey. Hi, how are you?
Pretty good.
Good. Good to see everyone.
There's several people still getting connected, so we'll wait just a couple of minutes. And I don't see David here yet. Oh, there he is. I see you. I was scrolling and I didn't see you. Okay, if everyone would put your name and affiliation into the chat so that Lisa Tunley can take roll, I would appreciate it. And Yolanda has already beaten everybody to the punch. After our guest speaker this morning, we're going to have a quick Zoom poll about how you would feel about setting up a regular monthly meeting time so we don't have to go through the process of checking everybody's schedule every month for your rounding calls. And so your program would have a set day and time every month. So we'll just take a poll about that. All right, while everybody's putting their name and affiliation into the chat, why don't we go ahead and get started? I think all of you know me. I'm Lisa Deshay. I'm an analyst who works for MIECHV. And David, would you like to introduce the other Dr. Bard?
Happy to. I know her quite well. For those of you who don't know, we share a household and a last name. And she's kind enough to join us today to talk about a new clinic that is starting in our backyard here that we thought many of you, certainly in the Oklahoma County area, will be interested in, but even in the Tulsa area, we think you would be interested in knowing that this program exists and it could expand in the near future. And Elizabeth probably has some other comments to share about infant mental health happenings all across the state. So I hope everybody had a chance to read her bio. And this is an area that she's very passionate about. We share this passion. She's out there on the front lines doing the clinical work with families who are facing serious adversities, young kids who are facing serious adversities. And I know she's just thrilled that some funding opportunities opened up this last year to make it official, this new clinic that houses some of the programs that they've been working on, primarily grant-funded programs with very select targeted samples. And now they're able to broaden that enrollment. And I don't know, like I said, she may have some thoughts on where this heads next beyond Oklahoma County. So Elizabeth, please take it away.
Thank you. And thank you guys so much for allowing me to come and take up your time in your meeting today. And I'm really excited to get to talk to you about our program. And then I'm happy to answer any questions at the end too. And then also once I run through the program, I'll make sure in the chat to put the link. So if you know of anyone that could benefit from receiving one of our referral forms, I'll put that link in the chat. Everything is electronic, so you can pass that on. And I also, we have brochures too that I don't know if I should give it to Lisa or somebody else on this call that could disseminate them too. That also gives just a rundown of all the things we offer and ways to make referrals to us. So
yeah, you can give those to Lisa Tunley, and when she sends out the recording of this, by the way, we are recording, and I hope that's okay with you. When she sends out that recording, she can distribute those as well.
Perfect. All right. Well, thank you. Well, as you know, I'm married to a researcher, so I thought I should start off with some research, some stats, recent stats here. So I was looking, in the state of Oklahoma, and as recent of 2020, we know that 53% of kids in foster care were between the ages of birth to 5. And that's almost double any other age group. And then when we're looking at confirmed child maltreatment, 43% of those kids are between the ages of birth to 4. So we really wanted to make sure, that we're able to target this special population of kids between 0 to 4. So there's no surprise when you're hearing about these stats, and all of you in this field know that there's a need in our state to serve these young children. And you guys know how crucial these early years are for rapid brain growth. We know, especially in the first few years, this is extremely important, and the brain is developing very rapidly. And we know that these experiences alter brain development. So when we're thinking about kids that have experienced adversity or trauma, right, we know these early experiences are impacting the way their brain is developing. And on the flip side, we know that these protective factors, right, so enriched environments increase the brain size and kids' ability to learn, and how important relationships are, right? So we know this is how kids learn, is through relationships, and how healthy attachment allows children to learn how to regulate themselves better. So if a trauma is overwhelming, or if the parent is under distress, children really have a lot of difficulty learning how to regulate. So take everything I just said, and we are wanting to figure out how can we sustain a program that helps, teach parents, whether it's birth parents that are having their own struggles and are at risk for losing their kids, or birth parents that actually have had their kids removed, foster parents, adoptive parents. How can we help make sure that we're giving kids the most success to benefit, and helping them have enriched environments and healthy attachments? So we're lucky enough, our program is funded through the Oklahoma Department of Mental Health. And we've been funded previously through several different federal grants through DMH. And when our last grant came to an end, DMH was very generous to say, we're going to fund you for 2 more years to help you continue to grow and develop this program. So we've kept it really broadly defined for our infant mental health program at Child Study Center. It's for any kid that's experienced an adversity between the ages of birth to 6. And so we all the providers, there's 5 of us that are in this program. We've all received specialized assessment training on infant mental health. And then we also wanted to target evidence-based treatments that are for prevention, and then also early intervention. So I'm just going to go through some of the different services that we offer in our program, and then I'll open it up to questions. But every kid that comes through our infant mental health program will receive a developmental evaluation. And so that looking at cognitive development, language, motor development, and we're also looking at attachment through some of that specialized training that we received. And we have this intake broken into 2 different appointments. The first is we do a really thorough clinical interview with the current caregiver. If DHS is involved, we'll also do an interview with a child welfare worker. And then the following week, we bring back the parent and the child to focus on the developmental assessment and those other relationship observations that we're doing for the attachment piece. And then after that developmental evaluation, we're going to come up with treatment recommendations for the family. And so we offer several different interventions. Some of these you guys are probably already familiar with. I'm going to skim through them. So if you have a need, or if you have a desire to learn more about them, I'm happy to, if you want to reach out to me, I'm happy to set up another time to give you more information on these treatments.
Elizabeth, you're not, you don't have a presentation that you're trying to show, are you?
No, I'm sorry.
Okay.
I didn't know if I needed to have a slide or show.
That's fine. I just wanted to make sure you didn't think that you were sharing. Thank you.
Yeah. The first is attachment by behavioral catch-up. So it's for kids birth to age 4. And so we're trained in a modified version, which is for birth up to 1 year, and then infant model, which is 1 to 2. And then we have the toddler model, which is ages 2 to 4. And so we know that if babies are born with difficulty, and if parents have their own difficulty, we really need to make sure we provide parents with education on how to respond and interact with their child. So if their child pushes back, or maybe they have difficulty soothing, that can create barriers to attachment. So the attachment by behavioral catch-up, again, a lot of research has been done on this treatment. We're implementing it in several different projects around our state, but the goals are to increase that caregiver nurturance and caregiver sensitivity, to decrease any kind of intrusive or frightening behaviors, and also to help with the child-parent attachment. There's been lots of research done on this model to show that even years down the road, kids that went through ABC model have better impulse control and better self-regulation, and their cortisol stress levels are better. And so a lot of good stuff to come out of this treatment. And it's only 11 sessions. So we provide telehealth services. And if you're local, so in Oklahoma County or surrounding counties, we'll do home-based services. But for further out, we also provide telehealth services as well. So we've been doing that for a few years once COVID hit, which is great that we can do more outreach to other parts of our state besides Oklahoma County. And then the other program we provide is Circle of Security, and that's ages birth up to 6 years. And Circle of Security parenting program also helps with secure parent-child relationships and how you can support and strengthen those parent-child relationships. I think it's similar, a lot of the content, to attachment biobehavioral catch-up, except it's a group parenting program. So they're learning similar things in the attachment biobehavioral catch-up, but for a lot of parents, they like having that support from other parents as they're learning the education about how to help increase that emotional bond between them and their children, and how to better help support their kids in behavior and emotional regulation. So we also offer Circle of Security through telehealth and also in person. And for the in-person group parenting program, we offer that 3 times a year. And we also have childcare provided, so parents don't have to worry about finding childcare, because we know that's a barrier for a lot of families that are seeking treatment. And then we also provide child-parent psychotherapy and CPP. Some of you might know it better by that acronym. And that's for children ages birth to 5, and it's for young children and their caregivers. The focus is on helping those young children and families recover and heal after a stressful or traumatic event. And so this could be, a separation from a parent, or multiple placements that the child has been through. It could be a medical procedure, or abuse or violence in the community. All those things qualify as a stressful or traumatic event. It's for kids who have behavioral problems, or family members that might have their own mental health difficulties, or parents that have their own trauma. And this treatment is more long-term. It could be anywhere from 4 months up to 12 months. So I will say with this treatment, there is more of an emphasis on working with the parent on how the impact of their own trauma or their own previous experiences is impacting their current parenting. And then lastly, we offer parent-child interaction therapy, or PCIT. That's another evidence-based treatment. It's the gold standard treatment for kids that have disruptive behavior problems. It's for kids ages 2 up to 7. And it also is an attachment-based treatment. It works on strengthening the relationship between the parent and the child, but then also giving parents different ways to manage difficult and oppositional behavior. So those are all the treatments we offer through our infant mental health program. And currently we are scheduling intakes in January, and we don't have a wait for treatment. And like I said, for those of you that are outside of Oklahoma County, we provide telehealth services as well. So hopefully we can reach more families outside of Oklahoma County. And I am open for any questions, comments at this time. And I'm going to put the link. I have a link typed out here that I can put in the chat too.
Okay, thank you, Elizabeth. Questions for Dr. Bard?
Dr. Barr, this is Patty. Any of your services are available for Spanish-speaking families?
Yes, Patty, I'm so glad you asked that. We are really excited that we have a provider on our team that is bilingual, and she's trained in all the treatments that I mentioned. She's actually the only therapist trained in child-parent psychotherapy. So we're glad that we can offer those services to our bilingual families.
Thank you.
Okay,
Lisa, I
go ahead.
just got
Go ahead.
one question. In the screenings and evaluation, you do also autism screenings as well?
We do not do autism screenings. I know there's such a need for that. And unfortunately, there's long wait list all over the state to get those types of evaluations. So no, I wish I could say we could help with that population too, but that is not a specific assessment we're offering at this time.
So Dr. Barr, with that link that you send, that's the referral form, and it's just, that is the only thing that's completed if one of our staff needs to refer families, and then you just take from there. Is there a place where we can put a note, like it's, well, maybe if you see just ethnicity, maybe if the family doesn't speak the language somewhere? to
Yes.
note it?
So we are lucky
And
enough.
notes, I see the notes.
Yes, so everything is in RedCap, which is an electronic database that we're using. So when you put in that referral, it sends it right into our electronic database. And yes, you can put notes, and then we, have somebody that's checking that every other day just to see new referrals coming in. Yes.
Thank you.
Yeah, and another thing I should note too, not only are we doing those developmental evaluations, we're also looking at social and emotional functioning. We're screening for trauma symptoms. Of course, for all these kids, since one of the criteria is having experienced adversity. And we're also, for some cases where we're thinking of child-parent psychotherapy, we're also giving the parent their own trauma measure to look at the parents' own trauma symptoms as well.
Hi, Elizabeth. I had a question.
Yes.
Who can refer to your clinic? Do they have to be a provider, or who can refer?
Anyone and everyone can refer. So thanks for asking, Lisa. We take self-referrals. We take referrals from providers in the community, from nurses, physicians. Anyone can turn in a referral to us.
Okay, thank you.
Yeah, child welfare, health department, anyone.
So Elizabeth, if we have a client that we think might want to participate in the circle of security, would it be that they would go through the standard, like get referred and do all the assessment and all of that to participate in that program, or?
That's an excellent question. If you know, like if this child is already receiving services, so maybe they're already involved in like Sooner Start, or they're already receiving, we have actually a referral that came through where two of the kids are already involved in speech services, right? And have already done an evaluation, so they necessarily don't need that. So if you have a particular family where you just want a treatment and you know that, and you don't feel like the evaluation is necessary because they've already had one, then that is fine, just to check that you're making a referral to that particular treatment. And then note that the developmental evaluation is not being requested at this time.
Other questions? David, did you have something you wanted to say?
I'm not sure about the wait list, but our guest speaker from last month, Dr. Bonnie McBride, is an expert in autism, and her colleague, Catherine Moore, my colleague, Catherine Moore, is involved in clinical assessments. So I don't know, Elizabeth, you may know more about this. Do you know the process for their clinic taking referrals for autism evaluation?
I know that right now for the Jumpstart Clinic, which is the clinic at Child Study Center that does autism evaluations. And they're actually even started, I think, tripling up, or they're doubling up the amount of kids they're seeing in that clinic. It's closed to anyone right now because the wait list is so long. I am not sure about the autism center though, as far as that process. There are other places though, and I'm happy to put in the chat. I have a list of places that I give families that are needing autism evaluations in Oklahoma County that I can put in the chat for those that, are just looking for an additional resource of referring. But I do know for our center, right now it's closed for any outside referral. Even inside referral, because we had a kid that we saw through a Better Chance clinic. So that's a clinic for kids that have prenatal substance exposure. And we had a child we saw that we did a screener and it turned out to be significant, and they wouldn't take our referral within house. So
I'm happy to pass
The
that.
waiting, the waiting list in almost all those clinics is a year or more, so it's a
Mhm.
little difficult when you refer families, but that would be wonderful if you just add that in case that we don't have one of those clinics. Thank you.
Yeah.
Yeah, thank you, Patty. Yeah, I was gonna say, we'll pass that question along to Dr. McBride and Dr. Moore as well, who are part of the autism center. There are lots of centers. So the Child Study Center is where Elizabeth's clinic is housed. We also, Dr. Moore is also housed there and does autism evaluations, although the wait list is long, as we're hearing here for that Jumpstart clinic. Dr. Moore, Dr. McBride have many connections outside of the clinic and outside of Oklahoma County. So we'll see if we can put together a statewide list and circulate it if that's of interest. I see some heads nodding, so we'll do that. Okay, so we have some follow-up items there, also in regard to making referrals to the new infant mental health clinic. But thank you, Dr. Bard, the other Dr. Bard, for joining us today, providing us that overview.
Thank you guys so much for having me. I hope that you guys will have families or know other providers in the community that will be interested in this service. And I'll put my email in the chat too. If you have any questions, feel free to email me. And then also, while you guys proceed with your meeting, I'll put together the other referrals for autism evaluations and put that in the chat too.
All right, thank you so much.
Yeah.
Lisa Tunley, do you want to talk about this little Zoom poll you're going to do in just a minute?
Well, I don't have much more to say than what you said. So I just want to know if a recurring monthly rounding call would work for everybody or not. So I'm just going to start the poll whenever it's time, and you all can vote. There's 3 options.
Yeah, you can go ahead and start it now and people can be voting. And
Lisa, just to clarify here, we're talking about the rounding calls that happen in between the monthly calls and not the monthly call, not the learning session, correct?
Yes,
right.
rounding calls. So the 30-minute calls we have each month.
Yeah. So then, if a program set a time, then it might be the 3rd Wednesday at 10:30 every month or something like that. And we would offer those times and you can vote on which ones. But right now we just want to know, is this a good idea or not? So thank you, Lisa. I wanted to say just a quick note about the slide template for the final PDSA presentations that we will have next month during the learning session. We will talk about that in the rounding calls before that learning session. And so, and you're an analyst and I can, if I'm not your analyst, we can even help you start putting that together during that rounding call. So we'll put that off for now and not have to go over it. I think most of you have done one of these presentations before. There might be 2 people who have not. And so that's all I wanted to say about that. And I'll turn it over to David to talk about the next learning collaborative.
Yeah, before I get to that, just to piggyback off what you just said, parenting app folks, those of you working on the parenting app, we're looking for one presentation from all 4 programs combined. So I would like Lisa, and I apologize if this hasn't come up previously. I'd like for all 4 of those groups to meet together for their rounding call, and I intend to attend. We have a dashboard. Some of you have seen it. If you haven't, it hasn't changed a lot in the last month or so. And part of the reason for that is that it's been slow trying to get recruits up and running with the crossover study portion of that parenting app study. I'm happy to say that I think we've got 8 participants now active. Everybody who was recruited to participate in the crossover had been contacted. I have a list coming your way either this afternoon or tomorrow that shows you when we contacted your recruits, what their response was. There are a few we had trouble and maybe still have trouble connecting with. So if they're still interested in your hearing that in your sessions, by all means, it's not too late. Please connect them to us. In the email that I send you, I'm also making a plea for new recruits. And we got news last week, we're able to extend our recruitment timeline for that parenting app study, which is great because we'd like to hit our target sample size of 50. That clearly pushes us into 2023. We've been permitted to do that with the funding that we currently have. So the recruitment will continue beyond December. We'd like to get a cohort though started this month, a new cohort. We'd like to start another cohort in January and maybe even one in February, depending on where the sample sizes are at. So more details on that for the 4 programs participating in the parenting app study by email, again, either this afternoon or tomorrow. Just waiting on that final table to show up that shows you what happened to all of the recruits that have been contacted for that crossover study. And then I'll join, as I said, the rounding call so we can talk through the presentation of the results for next month's learning session. Okay, what was my real topic? I forgot now. Oh, we're going to talk about the PDSAs for the afternoon of the learning session in January. We've talked about it now. It sort of feels like ad nauseum, and I'm sorry if I've spoiled the teaser here, but yes, it is coming, right? This day where we all get to interact with a care coordination web portal system. We've elected to go with the UnitUS system. The one major hiccup up to this point is that the final contract is not in place yet with the health department and with UnitUS. Until that contract is finalized, we can't put any real information in UnitUS, and you can't go there and make referrals or receive referrals. But that day is coming, and it's coming fast. And I mean, it could happen tomorrow, it could happen a week from now, it could happen a month from now. I don't know exactly when. It's in the final stages of that negotiation for the contract. As soon as the contract is inked, we're off and running. We have decided that with the uncertainty at hand, that the PDSAs in the afternoon next month will look a little bit different. We really want you to do group think and program think, maybe is what I should say, on your referral processes for clients that have a need that can be served by our 3 referral partner network organizations. So that's Sooner Start for early intervention. That's this new parent-child assistance program that is serving women with substance use concerns, and the Legal Aid Services of Oklahoma. All 3 have had a spotlight, like Dr. Bard did today, to tell you about their program within the last 6 months. They will be in attendance at the learning session, and you're going to get a brief summary of all the benefits they have to offer through their programs. You'll see that brief summary, and then we'll split up and do our afternoon PDSA development period. But it will be a little bit different flavor. We will focus on writing out the workflow of your existing referral processes, and then thinking of how that process can be improved, particularly for clients who can take advantage of the resources available from those 3 partners. We will have this outlined for you in more structure. In fact, I think we're going to try to put together a handout for you to think through this process that afternoon. But it will be different. We won't have a full plan and do section completed by you that afternoon, because we'll have to wait, again, as I said, for the UnitUS to be active, for you to go out and actually do the do portion of that. So without you having to rewrite your PDSA after that contract is finalized, and you have a better sense of what is capable in UnitUS, we want to focus on existing workflows and areas for improvement that afternoon. I'll float around, as will Lisa and the other analysts, to at least be sounding boards for you as you talk through areas that you think you can improve on as a program in terms of outgoing referrals to those partners, but also in terms of attracting clients, their clients, to home visiting. So that is also a dual focus here of the learning collaborative that is ahead. What did I miss there, Lisa? Tabitha's not on today, but Tabitha is somebody you're going to get a chance to meet and know very well in the Next Learning Collaborative. She's part of the so-called innovation project that's funding this next phase of CQI. She'll be working behind the scenes on putting all the pieces together, connecting Unite Us, not only with your home visiting programs, but also with the partner organizations. So Dr. Fleming, who I think we did get a chance to introduce at our last, one of our last monthly calls, will become a regular attendee for the Learning Collaborative sessions that are ahead. And you'll get a chance to hear from her in the monthly calls all throughout 2023, along with Lisa and I. Oh, Unite Us, that's what I left off. I knew there was something. So in addition to hearing from those 3 partner organizations, you're also going to hear and see with your eyes a demo from the Unite Us folks. So they're going to join first hour after lunch. And some of the program administrators, supervisors, you saw a version of this in our innovation calls over the last 2 months. We're going to now demonstrate this for all of your staff who attend the learning session. So they'll get a chance to see what it's like to make a referral in the system, what it's like to receive a referral in the system, and then answer any questions anyone has about what's to come. Okay, just to put a bow on what Lisa said earlier, the template really hasn't changed. So we'll send you that same slide template that you've had from past versions of the learning session in the rounding call. We'd love to have you start putting some of that content there so that it can be discussed with Lisa and with your analysts. We'll be helping the parenting app programs with that presentation. And I want to reiterate a comment or a sentiment from our last learning session back in July, and that, please don't feel constrained by the structure of those templates. I mean, we want to hear something about your P, your D, your S, and your A of your projects, but the forum that you present that, we're open to new ideas and new possibilities there. So
nobody's done an interpretive dance yet, so we're looking forward
we're really
to that.
crossing our fingers, hoping for that. Yes, I didn't want to say it out loud and spoil it for you, your creative thinking there. But no, yeah, I think I've said on a couple of occasions that working with the National Home Visiting Collaborative for tribal programs, they took this same idea and ran with it, and they had some programs do kind of mock podcasts about their PDSAs, and they had others do. It wasn't an interpretive dance, but they had a nice little jingle that went along with their slide presentation. So by all means, I mean, let's have fun with it. And if you think of something clever to add spice to those that dull template we've been circulating now for 3 years, you have my blessing and my encouragement. So go forth.
Okay, anything else, David, before we go to these PDSA summaries?
Lisa, I have a question for David.
Yes, Yolanda.
So David, when we start the new, of course, refer families, and you said there's going to be a demo to kind of get to know the system. That's going to be, I mean, I'm, using ETO. So the access for that is going to be supervisor, data person if we have one, or is going to be educators. Do you have any information in advance for that?
We're being flexible. I'm glad you brought that question up. So we're being flexible, and this is one of the topics we want you to address in the afternoon session. What makes sense for your program? Right now, with the partnering organizations, we have left it up to them to decide. Is this a front end that you only want a central administrative staff person to manage? Or is it something you want all your frontline staff to have access to and to utilize? Same thing goes for the home visiting programs. We've tried to convey that to supervisors in more recent sessions, but that's where we've landed. So we're flexible. whatever works best for you as a program, that's what we want to do. And in my mind, that's sort of how you're crafting your Plan, Do, Study, Act for the action periods that are ahead. You get to decide who does it make sense to put in front of Unitas. And you can change your mind on that. So, maybe you start off with a central staff person for your first PDSA, and it doesn't work. And you decide for the next PDSA, we're going to do it differently. We want our staff to actually have access to this. I think that would be a very clever use of this CQI period to sort of do it before and after of different staff utilization techniques.
Other questions for David?
Hi, Dr. Bard. It's Kathy in Tulsa. How are you?
Good. Hi, Kathy.
I have a question regarding like the comparison of pre-Unitas referrals. I'm wondering if Tulsa and Oklahoma City, because we have the ETO referral tracking mechanism, if it would be worthwhile, and I don't know who could do this on the data side at OSDH, maybe Anira, but looking at what our percentage of closed loop referrals have been pre-Unitas to kind of get a history of, because I know it's improved greatly. But the nurses, oh, I'm sorry, go ahead.
No, you go ahead. Finish
The
your thought.
nurses never really, they really never did a complete job of, because they would have to go back in and write in the notes that it was, the referral was closed out. So that I'm thinking that'll be a significant comparison.
And we relied on the client to let us know.
Yeah.
Where they were in that referral process.
So I'm just thinking ahead of time, if we knew that up front on that day that we have the learning collaborative, that might be helpful to spark some ideas.
It's a great idea, and you're I was going to say that you're a step ahead of us, but maybe only half a step. So we're working on that, and Andrew Peters, I don't know if he's on the call or not, but we are going to present data on that topic at the learning session. And
Andrew is on the call.
Okay, great. We've been looking at this for the current CQI period, and in fact, correct me if I'm wrong, but I think it was our LCDA programs, right? For one of your very first PDSAs in the developmental monitoring and promotion, you were looking at closing the loop for your developmental assessment referrals, developmental referrals. So we got a pretty good idea at that point, at least for those two programs, what we thought we were pulling out of ETO and how it compared to reality. And we made some changes to that. We're now doing that for everyone on this call, and you're going to see that data presented at the next learning session. I suspect that we still are missing some of that information. And okay, Andrew's saying that Cat Tulsa is already looking at that. Apparently you're doing that. Good. So we're going to be relying on you to tell us where our misunderstandings are with the current system, that we're going to present it to the best of our knowledge as sort of a baseline of where we stand. And then we are going to look, of course, to see how we improve once Unitas is active. This will be in the directive for developing I'm still going to call it a PDSA, even if it's not, if it's got a slightly different form to it. But the PDSAs you develop next month, we do want some component of measurement incorporated so that we can see cleanly from all programs, while we're all concentrated on this topic, what does the data look like from your program before Unitas is live? We anticipate that we'll have about a 2 to 3 month period there after that learning session, where you're collecting even more baseline data, maybe, dare I say, in an even more careful manner than we have in the past. And then we'll have a new PDSA kickstarted in the middle of that action period with Unitas Live, and that'll start that post Unitas era for that'll be the kickoff.
Great. Thank you.
Dr. Barr, I have a question.
Yes.
So for the 3 referrals with Lasso and Sooner Start, and so it's just 3 of them that will be in the other system. Do we still have to enter that in ETO if it's a developmental concern or referral? Do we still use ETO? Is it going to be entered in both places? Is that one is going to substitute at least those 3 aspects and the rest is going to be an ETO? Have you talked any of that with OSEH?
We have, and it sounds like the answer is going to be yes for all models, but there may be some model to model uniquenesses. And so, yes, we have met with all the consultants, and we actually have a meeting coming up later this month to put that on paper so that the directive is clear for everyone. This is what has to be an ETO for your model, for your program. This is what we'd like to see in Unite Us, and some of that's going to be duplicative. I wish that weren't the case, but at the way the 2 systems exist currently, we're stuck in that situation. Now, the advantage you get for putting that information into Unite Us is that you will be able to see that loop close. You're going to get feedback from these partnering organizations, who, by the way, are in the exact same situation. They all have their own legacy data systems or existing data systems, and they're going to have to log certain aspects of the referral process in that system, and then also log it in Unite Us. We'll try to get out in front of that issue before the learning session so that you have a pretty good idea coming to the learning session how much duplication is going to be required. And that'll probably dictate, I think Yolanda's the one that asked the question about who's entering the data. If there's a lot of duplication, I can tell you from the partnering organization standpoint, that has sort of pushed them to the central staff being the ones who interact with Unite Us. So they're going to take information out of their existing data systems and enter it into Unite Us to avoid frontline staff having to create that duplication.
And I mean, thinking that because the way, for example, in I think a couple of the people that mentioned, the referral tracking is also using when we had to do our quality assurance. I'm sorry, our blue ribbon with parents and teachers, they now have access to do to go in ETO. So I just don't know. I mean, if we don't put those referrals that we have done with the new system, I believe that we had to start, even if we refer through another system, we still have to put it in ETO because, I mean, that's the place that they have now access to do our, or our information. So, I mean, I just thinking aloud.
Yeah, you're right. You're right. And that message came across in the prep meetings we've been doing over the last several months with the model consultants and with the partnering orgs. So there's some duplication for all models that we just can't avoid.
Yeah, and another question that I think I asked a few months ago and also brought it up to our consultants is right now, I mean, we still refer families to Sooner Start, of course, but primarily, our first prioritized referral, it goes to child guidance, and after that, go to Sooner Start if the parents prefer Sooner Start. But I just, wanna, and I think I asked those questions, how this is going to change, when we do the first referral to child guidance, is going to be any changes? So I think it's a question more for them than for you, but I just brought it up.
Okay, no, that's good for us to know, though. Yeah, and every model or program is probably going to interact with these partners differently, and that's to be expected. So we want you to think about how you currently make referrals to those programs and how you can improve those processes, or at least the communication you have with those programs. So even if it's for a limited number of referrals, we think that that's a worthwhile effort. Our hope is that at the end of this, we have enough data to demonstrate that this is an improvement when we open up a pathway for these programs to communicate with one another back and forth. And it's not just a one-way communication. that we can leverage that and take this to even greater heights. So expand the referral network beyond those partners. You know, it remains to be seen if we can sunset any of the legacy data capture systems, but I think it's certainly going to, if successful, it's certainly something that administrations are going to have to contemplate. Do we continue forward with these system redundancies when clearly one system is providing us greater benefit than another? I'm still holding my breath a little bit. Maybe I'm too optimistic, but for the home visiting folks, at least, ETO, the parent company for that is Social Solutions, and they are been in contact with Unite Us for now well over a year, negotiating a contract to create interoperability between the two systems that would avoid duplication. You put information in one system, it automatically appears in the other. So that negotiation is still ongoing. And during this process, during our next learning collaborative, it's not beyond the realm of possibility that becomes a new functionality.
Any other questions for David? Okay, thank you, David. Let's go to a couple of PDSA summaries. Carolyn McCulpin from CAP Tulsa, are you here?
Yes, I'm here, and Ariane is here as well, so. And I don't know if Andrew wants to pull up any screen or not, but as he mentioned, we have been looking at the follow-up. My camera's acting up there. So, but we've been looking at the follow-up of developmental referrals. So after screenings with the ASQs, we're looking at the referrals made and then the follow-up of those referrals. And I think that what's happened is it's like every time we've been digging into this, it's kind of brought up maybe more questions than answers. So Andrew's helped us pull up some individual case studies because the numbers were not reflecting what we were wanting them to. And we were finding that there was some misunderstandings with the staff as far as the documentation. The referrals were being made, but many times if a parent was not interested or they were not showing that referral. So there were steps happening that weren't being clearly documented. And like one example I might say is that Andrew was helping us see where somebody might have scored below the cutoff, but then when the question came up, is a delay suspected? The answer was no. And when looking into that with the PE who did the documentation. Sorry, I'm here at the school and they were doing announcements. But as we were looking into it, the PE might have put no delay suspected because the parent said, oh, I've talked to the pediatrician about it and they're saying everything's fine, there's no delay. So we've just been kind of digging in and going over the procedure with the parent educators of how to document more clearly and to show those referrals that have been happening. And then after making the referral, then they can show that follow-up of no, the pediatrician, didn't think there was a delay or so on, but rather than cutting it off too early in the procedure. So here's some tables that, like I said, are showing maybe that disproportion of the referrals and that follow-up. And so our hope is, as we're trying to work through this referral system, that number will increase of the showing more clearly that when there's a delay suspected that referral is made, and then ultimately the follow-up. And so I think it's timely as we're looking into this new procedure with the Unite Us, that maybe that will be something that can help us to get that feedback loop and to see this all more clearly.
All right, terrific. Thank you, Carolyn, and thank you, Andrew, for being her Vanna White. David, did you have something you wanted to say about that?
I know we're short on time, but I have to ask. Okay, so I think everyone is aware that there's a report put together every year aggregating data across all home visiting all throughout the state and provided to the legislature. So this is one of the outcomes that they pay attention to. And it looks very similar at the state level as it does here for the individual program. We suspect that, the reason these numbers are not as high as we would like is because families don't, and I'll call it, accept the referral. But as you just indicated, it's not always really documented that way in the system. So I think this is more a comment than a question, that as that data, knowing that that data gets circulated beyond the boundaries of home visiting, beyond the boundaries of the health department, I think in this next quality improvement collaborative, we ought to think about how do we more formally capture those nuances so that outside consumers of this information fully understand the situation.
I think
Yes, I
that'd be,
agree. It's been
yeah.
eye-opening for us to see where, when we thought certain processes were clear to the PEs, where it wasn't. And so it's something that we're improving within our own system. But I think that that's a great call out that other eyes are looking at it.
I think we experienced the same thing that you did when we did our PDSA. So it was good for us too, just to improve the way that you do the follow-ups and just making sure that everyone is on the same page. So I guess that's, really good just to get into that conclusion and know exactly where you might be missing, the input of the information, or just, it's hard to really put from the referral tracking form, the follow-up. So it was just, it's more of a manual type of thing that you have to do. So just knowing those things is important. So that's why I'm excited to see what happens with especially the Sooner Start. And if that's going to improve, that'll be great.
Yeah, it does make me wonder if even in ETO, we ought to have another field here for, the reason I didn't make this referral is because the family had met with the pediatrician and the pediatrician already made a referral, or the family was referred years ago by their preschool teacher, or something to that effect. Because it sounds like in both these two instances that where we've taken a close look at it, that explains a large portion of the gap here between the ideal and reality. A lot of these families, we're identifying that there's a need. We go to make the referral. We don't really need to make the referral because it's already been made for us. And that we don't have a great way of documenting that now in ETO.
All right, thank you. I think we've got a lot that we'll be talking about that over the next several months. Yolanda, would you like to talk to us about your PDSA? Oh, you're muted.
I'm just gonna go ahead and share this information, although Liz told me to kind of show another, say something about our reading. But when I saw this, I think this is the very last one that Aiden sent it to us, and it's about increase of the reading time and also the play time or any kind of activities that the parents are doing with children. And I was very happy to see the pink because kind of represented 7 days, but I can see also the light blue, and which is 5 days a week, reading to the child and doing activities with child. But one of the things, and of course, we were talking in the rounding calls. I mean, if you can read with your child, but you have to have books available in home. So one of the things is, and we have created this a long time ago. It is a rotation library. We give the families, we lend the families a bag with 4 books. And of course, we had to stop when the pandemic came because we were not able, but we are picking up again, not with all the families, but little by little. Also, we have the Dolly Parton Imaginary Library, and I mean, Oklahoma City Public Schools is partnering with them. And I was looking at the website, and you just have to go ahead and look at the zip code that the family lives, because I think it's even the county, but more like the zip code if they qualify. And also we give it books, of course, the one they have been given to us. And we give books for families when they participate in the group connection. So we try to get as many books at the hands of the families. Also, I know Oklahoma City Public Schools is not for our group age, but of course, families, they have older children. They also are doing the program Raising a Reader from pre-K to second grade. So that is something else that the parents always have some kind of materials and books to read to their child. And that was it.
Okay, terrific. Thank you, Yolanda. I think it's exciting that there's this possibility of other organizations partnering with the Dolly Parton Foundation about her imaginary library, because she's given millions of books away to children all over the country, but Oklahoma really hadn't participated in that until recently. And so I expect that that'll really grow as people find out that it's going to be available.
I heard, oh, I'm sorry. I heard there is no many bilingual books available just yet. But one of the things that we always tell the families, you know, I mean, if the child is not reading, just make up a story. So, but I don't know if it's going to be any changes, but you know, this is something that I heard that they don't have a lot of bilingual books available yet.
Yeah. Okay. And children love to hear stories over and over. So even if they don't have a lot of books, they can cycle through them. David, anything else you'd like to say before we wrap it up? We have 3 minutes left.
I think we covered it. Thank you.
I think we have too. Thank you, everybody. Y'all have a great. Oh yeah, Andrew.
Yeah. So I've been distributing the PDSA to all those programs that have been using the mHealth app. And I was just informed today that I'd overlooked Kelsey Witt. And I wanted to ask while we're all here, is there anyone else I've been overlooking? Is there anyone here who thinks they should be receiving that mHealth app PDSA and has not been receiving it?
Should be 4 programs, Andrew. So Kelsey's program at PCCT, the 2 LCDA programs, and North Care Safe Care.
LaShonda, should you be getting that?
No, I actually wanted to make a quick comment before we shut down.
All right. So if anybody else was involved with the PDSA about the parenting app and you have not gotten a dashboard, please email Andrew or me or David. One of us will get the message to him. LaShonda?
Yes, I wanted to give everybody an update on the application we're recruiting families to be a part of the 2023 Parent Partnership Advisory Committee. And we have released the English app and flyer. And right now we're proofing and editing our Spanish application and flyer, and that should be out within the next day or two. So I have not forgotten. I didn't get out as quick as I would have liked, but I wanted to let everybody know that that will definitely be out in the next day or two. And so the application, they'll have the ability to select English or Spanish in that. And then also wanted to apologize. I'm not sure if we have any Children's First people in here, but we had put an apostrophe on the Children's First in our last flyer, but we have updated that as well. So I apologize for that. Thank you.
All right. Thank you, LaShonda. Everybody have a great holiday season, and we will see you on our rounding calls and in the new year.
You too. Thank you.
Bye-bye.
Bye.